Good evening and welcome to our webinar on specialty recruitment. This is our Four Nation webinar following the recruitment changes that we put in place during the pandemic, which are impacted across the whole of the UK. Now, we asked if there were any questions, and I'd like to say thank you for all the questions people have submitted in advance of this webinar. We'll be answering these questions as part of the presentations that we're giving tonight, and I'll be joined by two colleagues who will help me do that. Adrian Brooke, who's the Deputy Medical Director in Health Education England for Workforce Alignment, and Claire Wright, who's our National Specialty Recruitment Manager. Now, just to highlight to you, there have been a very large number of questions, and we may not necessarily get through everything you want to ask, but you have an opportunity to ask more if you use Slido. The Slido website is www.slido.com, and the code for tonight is #specialtywebinar, all the one word. So if you input in and give questions, we will try and answer as many as we can going through tonight. But if we find there's lots that we can't get through, we'll follow up with another webinar. We will only answer questions about specialty recruitment, so if you can contain your enthusiasm to ask us other questions, we will arrange further webinars on other subjects if you want. And one of the things that I think is important for people to know is that because this is being broadcast, we can't actually answer any questions about personal or individual circumstances. We also know that trainees and educators are busy, so we're recording this so that it's available to people who aren't able to join live. So if you keep a lookout for our social media, we'll let you know how to access the recording. So I am now going to hand over to Adrian. I'll keep an eye on your questions and he'll answer some of the many that we've had in already. Over to you, Adrian.
Thank you, Shona, and thank you to everyone for logging on tonight and taking time out to listen. So this webinar is being run really to give you all updated information on how recruitment is going to work for recruitment into August 2021, because it's not the same as in previous years. I think everyone knows why we need to make changes, but what we want to do is give you as much warning and advance notice as possible so you know what's happening. And we've had to adapt recruitment because public health advice has changed clearly. And we've also had to make recruitment this year resilient against sudden changes in the pandemic as it becomes more active and more prevalent, and also to make sure that it doesn't impact upon clinicians' times. That's your key clinicians in the fights here, and we don't want to compromise your time, and also the faculty that if you like, decide suitability for training, the senior faculty, their clinicians needing to respond to the pandemic as well. So we have to make it pandemic proof. And so the overall shape of assessments is in really two parts, with an assessment part, which is through the multi-specialty recruitment assessment tool, a self-assessment exercise, which will either be verified or sometimes unverified. And these have been used then to determine scores towards virtual interviews or assessments for the suitability to start training. And also in working out who's suitable to invite to the next stage. These things together inform the final scores and the ranking of those scores, and that in turn leads to working out who will get appointed, and if you are appointed, where your program will be run from. So learning from last year, where we had a traditional method, started the way we'd done it for years previously, we had to review that really rapidly, because literally within a few days and a short period after its starting, we had to stop everything. So we ended up looking at what had been submitted so far. So that was largely self-assessments, which are previously well recognised as methods for assessing suitability. But we knew moving forward, the reliance on unverified assessments as a wholesale exercise was not going to be satisfactory on the whole. And so we've learned lessons, and we've learned those lessons because we tried to listen really hard to the feedback from the colleges, who really work with us on the applications for the training programs. The specialty advisory committees who write the curricula and the personal specifications for those programs, and the trainees as well. So we, in the recruitment groups that help us run this, we have involvement from the BMA Junior Doctors Committee, from the trainees group at the Academy of Medical Royal Colleges, and also each specialty has trainees involved with their recruitment activities as well. So there's a multiple set of inputs, and we've tried wherever possible to respond to those different sets of feedback. And we will keep listening to feedback, and we realise there's a lot of anxiety about applying for training, and we will keep on trying to learn lessons as we go. And we are committed to look at the fairness of what we do to make it as fair as we possibly can. We have run an equality impact assessment that's been carried out on this year's recruitment, and that will be published by the end of the month. And the data is being prepared for publication. And here's just a slide shows you a little bit of advanced sight about the concerns that were raised. Were we doing something that was more unfair than previous years? And what you can see from this data, this is it's a big data set because there are thousands of people applying for specialty training. And they run, we have statisticians that help us run logistic regression to help us with the analysis. And that allows people to fit models where you can actually take into account each of the protected characteristics, and also an indicator of how this year, 2020 compared to last year, 2019, to see if this year was more or less fair than previous years. So that's how we can compare and make a comparison. And I've got 3 statistically significant findings to share with you. So we've got marginal evidence that the Asian British groupings fared better this year than last. So this year's odds ratio, when you compare to white British ethnicity, an offer made has the chance of an offer being made is increased by approximately 6%. So if for white British applicants that's a ratio of 1, it's increased by 1.058, and that's just significant at the 5% level. There doesn't appear to be any evidence of differences between the odds ratio for an offer made for the other protected characteristics, which I think is important. And the final thing, which is it's obvious, but I think it's worth stating, is that a smaller proportion of applicants had an offer made this year compared to last, and that's about the total number of applicants and the total number of posts. If you have a larger number of applicants as we did this year, then the number of posts remains relatively constant, the proportion will be smaller. So I hope that's been helpful. What I'll move on to now is answer some of the questions that people submitted beforehand, before I'll hand you on to Claire. So the first question was, what's the criteria of ranking self-assessment as the only measure for interview invitation? So in some specialties this was used. And this is not a new thing, it's been used for several years, and the colleges understand how it works, and it's felt to be a tried and trusted method by those specialties. So the second question I was asked we were asked was about would we release equality and diversity data for the 2020 recruitment round. And people were particularly concerned that there will be gender differences or BME differences, particularly adversely affecting the chances of being made an offer. And I think we can show that we haven't got evidence of that. Because the data is really quite complicated, we are just trying to get it in a way we can present that's easy to understand. So that's why there's a slight delay in the publication. The next question that comes up is why does HE seem to have reduced the number of jobs in anesthetics when they look at the number of posts in the February recruitment round that's currently happening? And this is due to the fact that most recruitment is made for August intake. So the vast majority of recruitment is for the August intake, and only a small number of posts relatively come up for the February intake. And those are available depending on what posts are in flux, if you like, as people leave training. And it's not a policy decision by Health Education England or other statutory education bodies to reduce the number. It's just what's available during the cycle. So the next question is, can you please explain requirements for online portfolio, the new format of the online portfolio? And the question was, will the points allocated for good portfolio presentation be removed? So the organisation points were removed earlier in this year. In some specialties do want to add it back, but in this case we listened to our trainee representatives on the groups who stated that due to the pressures that applicants were experiencing trying to deal with the pandemic, some trainees would not have a chance to really organise their portfolios, and so that's why it was removed. So that's the questions I've got and provided answers to. And what I'm going to do now is pass you on to Claire Wright, who's one of my colleagues who will update you on the changes to the recruitment timelines and tips for applying and offers. Thanks.
Thanks, Adrian. So it's my job to take you through some of the detail of what to expect for recruitment this year. I'm going to start by going through some of the general principles for specialty recruitment. So we've been in discussion over the last few months with various stakeholders, including trainee reps, to understand exactly what we've done in the early recruitment rounds this year and how we could improve things for next year. So we've come up with a set of general principles that we expect all specialties to adhere to in their processes for 2021 recruitment. The first of which is that all applicants should be aware of the selection process in place before they apply, and that any recruitment plans that are developed with the anticipation of further COVID disruption, make them deliverable regardless of any restrictions that are in place, and they won't be changed after you've applied in the same way as happened in 2020. So that's one thing that we've learned from last year's process. Where application numbers exceed interview capacity, shortlisting processes may be adopted by the specialties, and where self-assessment is used, evidence should be verified. So applicants should be expected to upload evidence to support the score they've given themselves, and this will be scored by assessors. There will be no face-to-face in-person interviews at all for the duration of the 2021 selection process, and all interviews will be undertaken digitally as a single panel. So the multiple mini interview panels that we traditionally use in a face-to-face environment will not be permitted digitally. Applicants will not be disadvantaged as a result of any COVID disruption, and we have amended both scoring criteria and person specifications accordingly to make sure that people don't miss out because of placements that they haven't had, or exams that they haven't had the chance to sit, courses they haven't been on, that kind of thing. Each specialty has been asked to submit 2 recruitment plans to the national team for consideration. We commonly refer to these as Plan A and Plan B, and all applicants will be aware of both of those plans before they submit an application for specialty training. So Plan A is generally the preferred selection process and will normally use a variety of different recruitment methods, such as an interview, verified self-assessment, multi-specialty recruitment assessment, that kind of thing. It's not limited to those. Plan B will be the selection method that will be adopted should delivery of Plan A become impossible. So if the surge of COVID continues and we can't deliver what we want in Plan A, there will be a Plan B in place, and you will know exactly what that is and what you're going to be assessed at. There is no opportunity for specialties to submit a Plan C at a later date. So if Plan B becomes undeliverable as well, then recruitment to that specialty will need to be abandoned. In terms of moving from Plan A to Plan B, it won't be a global move. So it will be undertaken on a specialty by specialty basis, and it will be down to the individual specialties to flag to us that there is an issue with delivering Plan A. So we won't make a decision from the centre that means that everybody and every specialty has to move across to Plan B. We will ask that the lead recruiter and or the clinical lead let us know in the national team that there is a perceived issue with delivering their Plan A proposal. We will then have a conversation with them and involve the BMA and our lead dean for recruitment to look at various options or other things that they could consider in order to make Plan A deliverable. If at the end of that conversation it is apparent that alternative ways of delivering Plan A do not exist, then we will make a recommendation to each of the 4 statutory education bodies in each of the 4 nations that we think we should move to Plan B. And movement to Plan B will only take place where all 4 nations are in agreement that that needs to happen. So in terms of the timeline for 2021 recruitment, round 1 timeline has been extended. So we won't be making offers until later than normal. And the round 2 application window has been brought forward to November 2020, with applications open on the 26th of November. We have sent an email to every trainee across the country, all 4 nations, who are either in CT2 or CT3 training currently, to make them aware of the application window change, because we know it is earlier than in previous years. And once that decision was made, we wanted to give you as much notice as possible in order to allow you to prepare for your application. The reason that we've changed the timeline is that the digital processes that we are delivering this year, so the online interviews, need a longer time span in order for them to be delivered. And the reason for that is that we can't interview as many people in one day as we would in a normal face-to-face interview. So the normal face-to-face methods, each specialty would probably interview up to 100 applicants a day, sometimes more than that. In a digital environment, each panel can only interview a maximum of 8 people a day. So as you can see, it's going to be a lot more prolonged. It's going to take longer to deliver that recruitment process. Hence, we've had to change the timeline. So the timelines for round 1 then. So the adverts will appear on Monday the 2nd of November, with applications opening on Thursday the 5th of November. Application deadline is 4 PM on the 1st of December, and the interview window will be from the 4th of January through to the 16th of April, with all offers being released by the 19th of April. Some specialties will finish their interviews before that date and may get their offers out before the 19th of April, but that's the date, the latest date that all specialties will release their first offers. The whole deadline and the upgrade deadline will be after that. So if you're applying to multiple specialties, you will have the opportunity to hold an offer until you get to hear from a preferred specialty, if that's the case for you. Round 2 then is the one that has changed quite significantly. So normally round 2 is advertised towards the end of January. This year we've made the decision to advertise at the end of November. So adverts will appear on the 23rd of November, and applicants will have the opportunity to submit an application from the 26th of November through to the 17th of December. Interviews will go from the 4th of January until the 4th of May, with initial offers being released by the 5th of May. Again, there'll be a hold and upgrade deadline after the initial offers go out. So in terms of planning and making your application, it's really important that you decide which specialties you wish to apply for. You can apply for as many specialties as you like, subject to your eligibility, And you can find out whether you're eligible for a specialty or not by reviewing the person specifications, which are available on the specialty training website. It's really important that you read all supporting information before you commence your application. So there's a generic applicant guide that's available on both the specialty training website and Oriel, but also it's important that you read the specialty specific stuff that the recruitment leads publish, because that will give you detail on exactly what you need to submit for each specialty. All applications are made through Oriel. It's important that you pay particular attention to demonstrating the requirements of the person specification, because those are the areas that you will be assessed against. And it's really important that you allow plenty of time to complete the application and familiarise yourself with the deadline. Every year, we have approximately 60% of applicants submitting their application in the last 48 hours of the application window. And whilst we put everything in place that we can to ensure that the Oriel system performs appropriately, when there are 10,000 applications being submitted in a 48-hour window, it's likely that the system will slow down. So please do not leave it to the last minute to submit your application. If you're completing a self-assessment questionnaire as part of your application, make sure that you choose the appropriate option and ensure that you have suitable documentary evidence to justify that score, because you will need to upload evidence to support that at a later date. Ensure you submit everything that needs to be submitted at time of application, and double check your application before you submit it, as you cannot correct mistakes later. Once your application is submitted, that's what you will be assessed on. It's really important that you access your Oriel account regularly throughout the selection process. Although most recruiters will send you an email with details about the recruitment process, in addition to a message within the Oriel system, we cannot guarantee delivery of that email because it goes external to the Oriel system, and based on firewalls and things in trust, we've found sometimes that they don't necessarily get through to your email account. So it's really, really important that you access Oriel regularly and check your messages, because a lot of the recruitment activities are time limited. It's worth noting that there's a new version of Oriel for 2021 recruitment, and there's a new URL that will be used just until January 2021. After that date, it will revert back to the normal Oriel URL. You need to register for an account. Even if you've had an Oriel account previously, you will still need to register for a new one on Oriel too, because account details have not been transferred across. So the multi-specialty recruitment assessment, or the MSRA, is a component that's used for a number of specialties at CT1 and ST1 level. It's a computer-based test consisting of two components, so a professional dilemmas test and clinical problem solving. Appointments of posts in general practice and core psychiatry for 2021 will be based solely on the MSRA, and there will not be an interview process. And the MSRA will be used for the first time in ACCS emergency medicine and paediatrics at ST1 level. It's been used by a number of specialties for a number of years, and has been shown to be a reliable and valid way of assessing a large number of candidates in a standardised way with limited clinical and administrative resource. I understand that it's concerning for some people who are sitting it for the first time and are perhaps only now finding out that they need to sit it. But what we have done is we've had some modelling undertaken around how the MSRA relates to selection outcomes in specialties that haven't used it before. And we've been able to do that by where applicants have previously made multiple applications and they've applied for a specialty that doesn't use the MSRA and a specialty that does. We can use the MSRA data to see how it would perform for the specialty that doesn't currently use it. And that data has given us some initial justification for use of the MSRA in new specialties in 2021. One of the big advantages of the MSRA is its flexibility, and it can be used in a number of different ways for different participating specialties. And the 7 specialties that have used it for a number of years all use it in different ways. So I think the same flexibility will be adopted with the new specialties using it this year for the first time. So if you're applying to a specialty that requires you to sit the MSRA, following the application deadline, you'll receive a message from the GP National Recruitment Office requesting that you register for the MSRA. And you only need to register once, regardless of how many specialties you've applied for that use it. Now, the message will come from the GP NRO because they're the office that administer the MSRA. If you haven't applied for GP, don't worry, it's not an error. It's just that they're the people that run the test. If you don't register, it will result in you being able to sit the MSRA and your application will be withdrawn. So it's really important that you action that message once you have it. Once you're registered, you'll be able to log on to your Pearson VUE account, and when you receive an invite to the MSRA, you'll be able to book your test using the self-service functionality at a time that suits you. Tests will be undertaken in Pearson VUE testing centres, but there will also be online capacity available for those who are either shielding or self-isolating. Those undertaking the tests online are recommended to check their connection ahead of the test taking place to avoid problems on the day. So your connection, that you can get onto the appropriate website, that kind of thing. And there are some practice questions that are available on the GPNRO website, and you can have a look at those and try them to get an understanding of the kind of questions that will be asked, especially if you're applying for a specialty that's using it for the first time. So self-assessment verification is going to be used widely for many specialties in 2021. So where you complete a self-assessment questionnaire as part of your application form, you'll need to supply evidence to support the self-assessment scores, and that evidence will need to be verified. Now, after application is closed, you'll be sent login details for the self-assessment portal if you're applying to a specialty that's using self-assessment, and you'll be given a deadline for submission of your evidence. Each specialty will determine the tags for the evidence submission, and these are broadly the question domains in the self-assessment criteria. So then when you upload your evidence, you can attach it to a particular tag so that when the assessors go in to review your evidence, they'll be able to see which evidence relates to which question. After the deadline is passed, assessors will be given access to review and score your evidence, and it's worth noting that scores can either be increased, decreased, or remain the same, depending on the evidence there in relation to the questions being asked. At the end of the process, where training offers are released, they will be made through Oriel, and they'll be based on your interview rank and your stated geographical preferences. So you'll have 48 hours to respond to that offer, and you'll have a choice of accepting it, declining it, or holding it. And the 48 hours does not include weekends, but it does include bank holidays. If you choose to hold an offer, you can only hold one at any time, and if you try to hold a second offer, your first held offer will be automatically declined by Oriel. Once you accept a post, you will not receive any further offers from the recruitment round at all. If you decline a post, it means you won't get any further offers from that specialty, but you may continue to receive offers from other specialties that you've applied to in the same recruitment round. And offers can be upgraded. So if you are offered a programme in your desired specialty, but not necessarily in your desired geographical location, you can either hold or accept that offer with the option to upgrade into one of your preferred rotations should they become available at a later date and prior to the upgrade deadline. And then I've just put the specialty training website up there, and just as for further information, really, there's a lot of stuff on there about recruitment, and particularly about the 2021 process. And we'll be populating that further in the coming weeks. You can also get further information from the specialty specific websites and from the Royal Colleges. So I will now move on to answer some of the questions that have come through prior to the webinar. So the first question is around how we know which hospitals will be expected to rotate between for a given specialty. Now, when you make your application, you will be given a number of preferences. Normally, you make these preferences slightly later on in the process. And these geographical preferences will tell you where the posts are. You can select the ones that you want to be considered for, and you can exclude the ones that you don't. If you choose to exclude a rotation from your preferences, you won't receive an offer for those at any point, even if it means that the offer goes to somebody lower ranked than you. So it's important that you're clear on that when you make your preferences. The next question is, will interviews be held online this year, and how will GP specialty training be affected? So as I mentioned earlier on the presentation, where interviews are taking place, they will all be held online for 2021. But for GP recruitment, it's all being done by the MSRA, so there won't be an interview for that specialty at all. How will the MSRA run this year, and when and how do we apply for the exam? So I mentioned that in my presentation. So once the deadline closes, if you've applied for a specialty that's using the MSRA, you will get an email with a login to register an account with Pearson VUE, so that you can then book your MSRA, and you'll then receive a date for that once you've booked it. How do I apply for GP? So again, it's through Oriel, and remember it's Oriel 2 for 2021. Someone's asking how many referees do you generally need for applications? Each application will ask you to list 3 referees, and normally it's people that have supervised you in the last, I think it's 2 years of training. For those of you applying for ST1 where you may not have sufficient work experience, you just need to make sure that you put the reason why you haven't had people for more than 2 years ago is because you're obviously at medical school at that point. Next question is, how should we score posters, publications and presentations and audits that have not yet been completed but are likely to be in time for the interviews? So here it's important that you look at the criteria that the specialties are scoring you against. So they are being reviewed in light of COVID, and they'll give you examples of when you need to provide the evidence. So it might be presentations by the date of interview, it might be presentations at the time of application. So it's important that you read that guidance and score yourself accordingly. Next question is, will the new weighting of interviews, shortlisting scores and MSRA scores be transparent and available? So the answer to that is yes. All specialties will publish their scoring framework and let you know exactly what you're being assessed against before you make your application. What measures are being taken for equity considering cancellation of exams and courses? So we've amended all person specifications for 2021 and we've taken out all named courses. We've also amended the exam requirements. So whereas previously you might have needed a membership exam by the time of interview, it's now needed much later, in some cases by the end of the ST3 year of training. Due to COVID, some rotations were paused or some people were redeployed to other areas, meaning they missed out on what were essential or desirable rotations which we needed for core training. Will this be taken into consideration? Again, person specifications have been amended, so people will not be disadvantaged. Without clinical stations at interviews, international medical graduates will be unable to compete with local trainees based on penalisation for too much experience in their home country. Interviews will cover a wide range of topics. It won't just be based on experience. So it will be lots of competencies as in previous years. It will just be a digital scenario and a slightly shorter assessment time. So I don't think people will be disadvantaged by that. And the final question I have here is, I took 2 years out of training after FY2 to work abroad and volunteer. For general surgery, this means a far reduced uplift on scores for trainees like myself taking time out. How will the application process work to stop this disadvantage through uplift? So for all surgical person specifications for 2021, where there is a desirable maximum experience level, that's been increased by a further 12 months to take account of this year and to ensure that people aren't disadvantaged. That's all of my questions answered, so I'll now hand back to Shona.
Good. So some of the questions people have been asking in the Slido have already been covered. One of the first questions that came through is, why didn't we listen to trainees or to trainee representatives from the college or to the BMA? I think the answer to that is we did listen. And the problem with what we're trying to do at the minute is we cannot please everyone. And we are having to find the best solution. With the plans that we have a plan that is workable for recruitment. One of the other questions looked at, how are we going to make sure that trainees progress and that we don't have a problem with people not being able to be recruited in the future. So ensuring that there is a recruitment process was a priority. We have very much tried to work with trainees and with the colleges to find the best solution, but it may not be the solution that you want. It may not be in the future when we look back, perhaps the best one we could have chosen, but at the minute it's what everyone believes is the best solution for all the different specialties. And there is lots of different thinking went into why different methods were chosen, and what we hope to do is work with the colleges so it is transparent to those of you applying why we've made the decisions we have. a lot of the questions that have been asked have asked, why did you look at different elements and why did you make the decisions? And I think if we can explain to people going forward why we've made the decisions, it might help you feel more comfortable about it. So if I go down, looking through some of the hundreds of questions, is the change to recruitment permanent? Someone has asked, we can't say an exam's good enough 1 year, but not at another year. One of the things we're doing is very much looking at the effect on specialty recruitment, on the outcomes, as Adrian mentioned. And recruitment is never going to be exactly the same as it was. I think we need to build on what we've learned. But at the minute, we're not saying anything we're doing is a certain way for the future, because we need to evaluate what we're doing and look at what we can do better, what we can learn from what we're doing, and what there is that's come out of this that will help us bed down things in the future. Now, one of the questions is, have those who've been due to complete a degree or qualification that they would have completed or been awarded in the usual application round get points even though they won't have completed it as it's in progress? There's also a number of questions about the information in person specs. So Jonathan, are you on the line? Do you want to mention what we've done with person specs?
Thanks, Shona. So we've been working with specialties and recruiters to mend person specs and self-scoring criteria to take that into account. We've been keen to try and remove anything that could disadvantage applicants that may have not had the experience of the changes due to COVID in the last 12 months.
Okay. So there have been changes in all the person specs. It's worth looking at that, but you have been going through them all to try and minimise the impact of the changes that we're putting in place. There's a lot of questions, detailed questions on things like anaesthetic training and on specific elements of that I think we will feed back through the Royal College of Anaesthetists, that we perhaps need to help them with answering a number of them. There's one about core surgical training. Is that how are we running that this year? Jonathan, are you able to answer that one?
I can do. So core surgery, I'm just getting my list up. It will be self-assessment, verified self-assessment, and then an interview for selection. If the number of applicants exceeds our interview capacity, we may need to use self-assessment to shortlist, but that's in line with previous years.
Now, there's been a question about GP recruitment, but I think, Claire, you've answered the fact that this year it's only going to be through the MSRA. Now, one of the things someone has asked, will specialty recruitment for the next year be virtual rather than physical interviews? I'm not sure what you mean by next year. If you mean 2021, what we're looking at the minute is not anticipating being able to run interviews. If you mean the year after that, 2022, then perhaps that builds on what we're learning from this process. And what will interviews be like in the future? How will we recruit to specialty training? One of the things COVID is doing is making us re-examine all the ways that we deliver education and training, whether that's recruitment or progression. So for 2021, there will be no face-to-face interviews. If the question is about 2022, then we don't know yet. I'm applying the only. So some people are worried that everyone's expected to sit the MSRA, but only the ones that Claire has mentioned will need to sit. Claire, do you want to answer that?
Yeah, so the new ones for this year, in my presentation I said ACCS emergency medicine and paediatrics. It's also anaesthetic CT1 for this year as well. There's 3 new ones.
So thank you, Claire. For surgical training applicants, do we know when retrospective self-assessment scores will be available? Because the application deadline's been brought back, which is a lot of time. And somebody seems to think it's been brought back at least 5 months. Claire, do you want to clarify on that one?
Yeah, so I assume we're talking about ST3 surgical specialties here. So the application time has actually been brought forward by 2 months rather than 5. It's normally the end of January. It's been brought forward to the end of November. In terms of the self-assessment criteria, we are working with specialties to get these out as soon as possible. The decision to bring the recruitment window forward was only made probably 2 or 3 weeks ago. So we are now working with specialties to make sure that no one's disadvantaged and that they are amended appropriately before they're published, but we're hoping they will be out in the next week or so, so in plenty of time before you have to make your application.
Thank you. There's a question about deferral. When applying for its IMT training this refers to, when applying for training this November, will there be a possibility to defer start dates? And if they need to defer, when do you need to make that decision? So I'm not sure that's necessarily COVID related, it's more a normal recruitment question. Claire, are you happy to answer that one as well?
So for deferrals, normally we only allow them for statutory reasons, so things like maternity leave, sick leave, paternity leave, that kind of thing. This year we did have a deferrals policy based solely around COVID, which was if you couldn't get competencies in time or you couldn't get into the country, that kind of thing. Currently we don't know if that will still be the case for 2021, because obviously August 2021 is still quite a way away. But if it looks like we need to have that deferrals policy, we will obviously review that nearer the time. But currently, if it's anything other than a statutory deferral, we can't answer that question at the current time.
Thank you. So another question, would a UK medical school graduate currently working in foundation be exempt from the RLMT when applying for the specialties? Claire or John. Claire, you've got your hand up. You're on a roll, so if you're happy to answer that one, that would be helpful. Thank you.
So all medical practitioners now sit on the shortage occupation list in the UK, which means that they're all exempt from the resident labour market test. So yeah, anybody anywhere in the world who is a medical practitioner does not need to meet the RLMT.
Thank you. Interview dates are currently being confirmed for all specialties, and you're going to publish them on the website in a couple of weeks, is the answer to one of the questions, which I think, Claire, you also covered in the presentation. One of the questions has asked, with people having to sit the MSRA, do we think that that will put people off and we'll have more people not going directly into specialty training? I think the view across all 4 nations is that we want doctors to train, we want them to come into specialty training, but we want them to come into specialty training when they are ready to do so. And if people take some time and then apply, that's the pattern that we've been seeing over the last few years. And it will be interesting to see what happens this year and whether the MSRA and having to sit it has an effect. But what we're doing is feeling confident that it looks like the same number of people are applying each year, though there may be a gap between foundation training and specialty training. And it will be interesting to see whether COVID and the work involved changes that, and whether having to sit the MSRA. I think there may be a number of reasons, and it'll be interesting to look at how we could analyse that from some of the questions that we asked on Oreo. Now, trying to find the next question. Has there been a significant impact on recruitment numbers due to the pandemic, with people being able to move in and out? And will we make sure that we don't disadvantage future applicants? Adrian, did you want to answer that?
Yes, thank you. Currently, we're anticipating a similar number of posts available for application this year as last. So in the short term, there's not been an obvious effect. I hope that's short and relatively sweet and a clear explanation. Thanks.
Thank you. Anaesthetics. There's lots of questions for anaesthetics, very detailed questions. I don't know, Claire, if you want to make any comments about the multiple questions on anaesthetics, or whether we will just say that we will. I think what we need to do with some of the anaesthetic questions is actually talk to the college and tell them that there are a significant number of you asking questions, and we'll do some joint communications with the college so that people have their answers. We can get answers to the questions that you put in, and we'll try and have an increasing number of FAQs so that you all get an answer to your question. Now, where have I got to down the list? Can I see a blank application form applying to the opening of August 21 application? They want to be able to see it. Is there any way you can see what a form looks like? Claire?
No, so the application form won't be available until Oriel opens, unfortunately. We don't keep a Word version of it because of the amount of validation and sort of progressive disclosure questions and things in there. It's quite a complex application form, but when the application window opens, you will have 3 weeks to submit an application, which will be plenty of time for you to complete it, so don't worry.
Thank you. Can we apply for Group 1 specialties this year if you're in IMT in year 2? Adrian, do you want to answer?
Well, I'm going to shamelessly nick Claire's intelligence on this, but I think that we understand there will be very few Group 1 specialties advertising in England, although it's still under discussion with the other nations. You remember, this is a 4-nation process, but for England, but there won't be many.
So we will be letting people, one of the questions is people are wanting to know the kind of numbers that there are available for specialties and the posts that are available. How do you know if you're applying for a specialty, whether there's hundreds of other people or just a few in the posts available, Claire? Asking you because you're more likely to know than me.
So I think the question relates to people making or ranking their preferences and not knowing how to do that if they don't know how many posts are available. What we would say is that actually the number of posts available shouldn't affect your preferences. You should just rank the posts in the order that you would want them should they become available, because even if something has 0 preferences at the time you make your application, it might have posts available later on. And if you haven't ranked that for any reason, then you wouldn't be considered for it. So in terms of making your preferences, do it in the order that you would want the post, and don't think about how many posts there are available there and what the competition is, because when an offer is made to you, it will be made based on your offer and which of those posts are available at the time that your rank is reached. So it's really important that you preference everything you're interested in.
Thank you. There's a question about surgical ISTs and benchmarking, and that's still under discussion, and we will update we'll update you as soon as we have clarity on how we're taking forward. We've been discussing with the surgical colleges and with the trainee groups and with JCST the best way to manage this going forward, and we will let trainees know as soon as we can. What will happen if a candidate has COVID or is self-isolating when the MSRA is held? Because I'm sure that will be of concern to people. Adrian, do you want to answer that one? Claire?
I can.
Jonathan. Okay, the voice from the background. Yes, please, Jonathan.
So the MSRAs, you're able to sit that in person at Pearson VUE Test Centre, or you can do it online from home. You'll be able to choose which you'd like to do. If you are going to do it from home, I think Pearson VUE do want you to sort of test the equipment, because you will be reliant on your own equipment and internet connection, but it will be available for those that do want to take it from the home or anywhere else online.
Thank you. We have heard the concerns of trainees who have to shield, and we realise that not only do you have the concerns relating to shielding, but you also have concerns about your training progression. So we have been bearing that in mind. So most of the questions, I think, what was the reason for the large increase in the total number of applicants in the 2020 recruitment year? Who wants to explain the immigration changes? Jonathan, do you want to do that one?
I can try. So last year was the first time that all doctors were put off on the shorter specialty list, and therefore applicants could apply on an even footing if they needed a tier 2 visa. So we think that was the main reason for the increase in applications, and we'll be obviously monitoring it for this year as well.
Thank you. I'm thinking, looking through the questions, that most of them now relate to our very specific detailed questions about the individual specialties. And I think what we need to do is work with the colleges to make sure that you get that information as soon as possible. I think for me, it's important to say thank you for listening, and we know it's stressful. I think applying for your future career is always stressful because it matters. Your personal identity, your job is such an important part of your life, and it's always been stressful, never mind having the concerns about COVID and the fact that we're changing the processes. It may feel like we're not communicating, and part of the reason for that is that we have been trying to get you the accurate information and to work with as many people as possible to get the best solution. As I said, I'm not sure we will be able to please everyone, but to get a solution that works as well as possible, allows trainees to be recruited, is as equitable as possible, and that we will continue to evaluate. So we hope it's useful covering it in this format. I'm aware we haven't covered some of the specialty specific questions, but we will get that information out to you. And if there are things that you would like us to cover, then it would be good to know whether you're finding them useful and what you would like us to cover in the future. Now, at the beginning, a couple of people said that why didn't they hear about this till they saw it on a WhatsApp group, but we do try and let you know in advance on our social feeds. So if you can keep an eye on them, we will keep you updated on when we are providing any more webinars like this, and also when we upload new information onto our website, especially with something to do with COVID and the changes going through. So thank you for listening. I'd very much like to thank Claire and all the recruitment teams that work not just to provide answers in the webinar, but to provide answers and help deliver specialty recruitment, and Adrian for their answers, and Jonathan as the voice occasionally from the background, and our comms team for making this work. And I hope you found it useful, and please continue to ask us questions, and we will try our best to be transparent about our processes so you understand them and to answer the questions that you have. Thank you, everyone.